It is great to be here. I always enjoy addressing college students, and perhaps some of you are beyond college, but you're still interested in becoming a physician. As was stated in the introduction, I've had a varied career. Started off as a teacher, became a college administrator. Then I was persuaded to run for the legislature, and I spent 12 years in the legislature, the last 8 of which I was a state senator. And when I left the legislature, they asked me to become the Chancellor of the California Community Colleges. I know it sounds a little bit like I can't hold a job. Of course, I've made adjustments. I'm a little bit like Mark Twain. Mark Twain, when he was a young man, went to Carson City, Nevada. And he wrote back to one of his friends describing the wildlife in Carson City. And he said, you know, there are loose women on almost every corner. He said the gambling goes on all the time. There are many saloons. He said, this is no place for a good Presbyterian. Therefore, I no longer am one. But I'm excited about this event. I had not, pardon me, I had not known about it until Jubin came to my office and talked to me about this great event that attracts literally thousands to come to this. And I know quite a number of you are community college students. In fact, in reading the statistics, I understand that during the 6 previous years you've had this particular conference, that 3,765 students from community colleges have attended, that they've come from over 60 of our 110 community colleges throughout the state of California, and 92% of those individuals have then transferred to 4-year universities. Some 1,882 are currently in medical school. So that shows that there's real success that's happening in our community colleges, and I'm sure in our universities, considering those who are in turn looking at medical careers. And despite the fact that there's a lot of controversy now around health care, I want to encourage you and tell you that the health care field is going to be with us for a long, long time, and there will always be jobs in the health care field. In fact, most of the studies that I read, whenever they indicate the occupations that are going to grow, health care is right there at the top of the list. After all, our population has a larger and larger number of elderly people, and unfortunately, those of us who get old tend to have a few more health problems, and so there will always be a need for those who are involved as physicians or in healthcare-related fields. So I think you've chosen a great field. In fact, right now, 15% of our national gross product is spent on health care. That's one of the problems we have, because we can't continue to have a higher and higher percentage of our gross domestic product being spent on health care, and that's one of the reasons why there's such a drive for health care reform. And no doubt, as you've read about health care reform, and I don't intend to take a position one way or the other. I would certainly have to if I were in the legislature or in Congress. But I do believe there is a need for reform. Not that there isn't good medicine being practiced in the United States, but the fact that 15% of our population is uninsured is an indication that we've got to move toward having health care for everyone. I want to see health care a basic right, just as education is a basic right. You had the assurance that when you began school, that regardless of your financial status, whether you were from a low-income or a high-income family, that you were entitled to a public education. And I believe that we ought to get to the point where every American is entitled to health care, that no one should have to suffer because of a financial lacking. I think it's in our national interest to do that, because when we have a healthy population, we have a much more productive population. So I believe strongly in what health care can do for an individual. I personally, for instance, I take 3 health newsletters because I believe that I'm primarily responsible for my health. But I'm not only responsible for my health, I go to physicians on a regular basis. I have an annual physical. And if I find in reviewing my body that I have some problems, I'm someone who's quick to go and find out exactly what's wrong. I try to follow some good dietary practices, and I exercise a minimum of 4 times a week. And so I'm trying to maintain this body, because really health care is the framework of our life. If we're not healthy, then we can't do all the rest of the things that we would like to do. We can't work productively. We can't enjoy life. It's not enough merely to keep us alive. We want the quality of life to be good. And so you're going into a very meaningful profession, because you can look on what you do and say, you know, this is making a difference in people's lives. I spent my life mostly in education, and I can look back on it and feel good, because I can say, you know, it's probably not the most remunerative profession I could have chosen, but it's a profession in which I feel very good about the contribution that I've been able to make to people's lives, that I feel a sense of self-fulfillment. And so find out what your passion is and follow your passion. Let the money come secondary. Don't choose anything simply because that's a way to a lot of money. Rather, choose your passion, and then as a result of your doing your passion well, in all probability, the money will follow. But certainly, your sense of fulfillment, your sense of happiness will be that much better. Since I am Chancellor of the Community College, and since a great number of your students that are here today are products or are involved as students of community colleges, let me give you a little bit about the status of community colleges in California. In the United States, community colleges are being recognized, pardon me, are being recognized more and more as one of the great solutions to higher education. This year, in California, 2008-9, we educated 2.9 million students. That's by far the largest system of higher education in the United States. And of course, those individuals represented those who only took one course, maybe an adult who wanted to come and learn a skill, or individuals who wanted to come and be full-time students. And so we have full-time, part-time. We have individuals who are simply taking, on a few occasions, some non-credit courses. Maybe they want to enrich a certain skill that they have. Credit courses, we are really the avenue for most of the students of California when they first enter higher education. A large majority of those who are first-time students in higher education come to the community college. We are nationally being recognized. President Obama has said that community college students are those who, our community colleges themselves are going to be a great force in rescuing our economy that's in the dumps right now. The reason is that we are involved in job training. We have, by the way, a lot of short-term health care programs, whether it's dental technician or dental hygienist or emergency medical technicians, nurses, all of those are trained in the community college. So many of those who will be assisting you in your health care, if you become physicians, will receive their training in community colleges. Jill Biden, the wife of the Vice President, Joe Biden is, I need a little help here on this. Can you hear me in the back? Oh, I see. He said it's a little bit more going on in other rooms. All right. That's to give you an idea of kind of the national picture. Martha Cantor, who was the Chancellor of the Foothill de Anza Community College District here in California, was recently named as Undersecretary of Education, second in command under Arnie Duncan, who is the Secretary of Education, and is over all of higher education, and that's the highest post that anyone from the community colleges has ever experienced. But despite our good national reputation and a surging enrollment, you know that the state of California has had some terrible problems financially. In the last 2 years, the budget of the state of California has gone down by 18%. And that's impacted education, because education makes up almost 50% of the state budget. So you have all experienced, I'm sure, some problems in college. Tuition fees have gone up, unfortunately. Classes have been closed in some cases, or perhaps you've been denied admission to either UC or CSU. And so you are confronting the financial squeeze that is happening. Community colleges received an 8% cut in our funding. In other words, we're getting 8% less in 2009-10 than we got in 2008-9. Now, that's the reason why that maybe if you're a community college student, you have found it difficult to get all the classes that you want to get, because colleges have had to cut their schedule back. Not because they didn't want to serve you, but you see, every community college has an enrollment cap. That is, they can only educate a certain number of students and get paid for it. Now, if they educate beyond that, you get the education, but they don't get any money for it. So merely out of financial necessity, many community colleges have, as a result of that, had to reduce their schedule, not because they don't want to serve you. In fact, we in the community colleges would like to serve every student we possibly could. But the financial strictures of the state, the same thing applies to CSU and UC. They're facing financial pressures. And so, unfortunately, they've had to raise tuition. And I would say that in the last 10 years, tuition has gone up at a much faster rate than inflation has gone up. And the reason is rather simple, and that is the state has been insufficient in the way in which it has funded higher education. So that's a little bit of our problem. And what can you do? Let me tell you, you students have more force than you realize. And I would suggest that you make your needs known to state legislators. In other words, you form groups that go into legislators' office and let them know how important higher education is. A recent study by the Public Policy Institute of California indicated that by 2020, we will need 39% of all the jobs in California will need a bachelor's degree. But at the rate we're educating, only 33% of California's population will have a bachelor's degree. So we are really being very short-sighted as a result of what is happening in the state legislature. So you as students, let your voice be made known. Go into legislators' office, rally, and do everything you can to increase higher education expenditure in the state of California. But now let me talk to you on a little personal level. In the book written by Scott Peck, which is entitled The Road Less Traveled, he started it off with this arresting phrase: life is difficult. He begins then by pointing out that almost any goal in life has to have some difficulty connected with it, and that there will be in your life some unexpected difficulties, difficulties that you're not responsible for. Maybe the loss of a loved one, maybe the failure to get a job or be denied a promotion, maybe some financial difficulty that you'll experience. So he did not say life is lacking in joy or you won't be happy. He just said you have to accept that the terms of life are that life has its difficulties. And so when it has difficulties, you can't simply fold your arms and quit and say, you know, I thought this thing was going to be easy. Well, it's not going to be easy, and particularly it won't be easy in terms of your future education, your medical education. You'll perhaps have to borrow money. You may find it very difficult to get through. You're going to have to spend some nights studying, maybe all night long. You're going to have to work hard. But the goal is worth it. But don't get discouraged. Fulfill your dream. If you have a dream, it's going to take some work. When I was an undergraduate student in Texas, I had decided I was going to get a bachelor's degree, and I had a couple of professors who talked to me and said, you know, Jack, you ought to go on to graduate school. Now, shortly after I finished college, I got married. We had children. But I kept that dream alive. And so I moved to New Haven, Connecticut, and there I got a Master of Divinity degree at Yale. And then later on, I came to California, and I got a Ph.D. in history. And that wasn't easy. I had a family to support. But I'm so glad I did that. I'm so glad that despite that difficulty, I recognized it could be done. And so I want you to set your goal. If you've decided that you want to be an MD, then I think that's great. But I want to warn you that there'll be times when you'll have to sort of reach down deep. You'll have to realize, well, I can't really buy that new car. I've got to keep driving this old jalopy. I can't really do everything I want to do, but I'm going to get that degree. And when you spend those long hours as an intern and you're lacking sleep and all the rest, it's going to be tough. So life is difficult, but life is rewarding. And I am so moved by seeing this huge crowd of people that have come here because you're interested in pursuing a degree in health. We need you. The nation needs you. The quality of health care in this nation is terribly important. I one time said to somebody that if you're rich and you live in America, you get the best health care in the world. But I'm not quite so sure that you get the best health care in the world if you're poor. Because sometimes as a result of the cost of drugs and the cost of visiting a doctor, people put off doing it, and then suddenly they have to rush to an emergency room, and there they get health care. But it would be so much better if they received regular health care and therefore prevented that trip to the emergency room. So you have a great mission in front of you. You're going to change the lives of people. You're going to save lives. My father was born in the, actually in the late 19th century, but in the early 20th century. He was a young boy in a West Texas town living on a farm, and he had an appendicitis attack. He was the first one in that West Texas county to be ever operated on for appendicitis. And there was a young doctor in town who said, I've seen it done, but I haven't done it myself, but I'll give it a try. And so they put him on a kitchen table, and they took out his appendix, and they saved his life. Now, that's a story that means a lot to me because it had something to do with my eventual existence. So just that kind of thing is the kind of thing you can do now with much more modern techniques, with the wonderful surgical abilities that you have, with the drugs that are available, with the kind of preventive medicine that you're going to practice when you talk to patients. So you have a wonderful passion here. You're going to do something that will make a difference in people's lives. There'll be children that will live as a result of the work that you do as a physician. There will be people whose quality of life is greatly improved. The pain will be removed. As a result, for instance, of my wife's back surgery over a year ago, she's now free of pain because a very capable neurosurgeon went in and made the quality of her life so much better. So I'm a believer in medicine. I'm a believer in the careers that you're undertaking. So wherever you are in that search, whether you're a first-year community college student, whether you've just graduated and are going back and studying, and I talked to a young man this morning who told me that He'd received his bachelor's degree from University of California at San Diego, but now he was studying at San Jose State because he decided that he wanted to become a doctor, and so he needed to take those science courses. So wherever you are, keep that dream alive. Yes, I'm going to be frank with you, it's not going to be easy, but nothing in life that's worthwhile is easy. So with that in mind, I encourage you, and I thank you for the opportunity of being here this morning. Thank you very much.